Hello, my topic is crazy paving in pulmonary alveolar proteinosis. Definition. The crazy paving pattern is a common finding on thin section computed tomography (CT) of the lung. It consists of attenuation of scattered or diffuse ground glass with overlapping interlabular septal taken in an interlabular lines. Pulmonary alveolar proteinosis (PIP) is a rare disease characterized by the accumulation in the pulmonary alveolus of a lipoprotein material derived from alveolar surfactant, which causes the cancer-caused direction of gas exchange.
So PAP, or pulmonary alveolar proteinosis, is a disease caused by, it's an autoimmune disease. In a healthy lung, we're constantly making and recycling surfactant through the action of GM-CSF binding to macrophages. Macrophages are then able to process the lipids and proteins of the surfactant and keep a healthy balance. As we all know, surfactant is necessary for gas exchange in the lung. In a PAP patient, there's an autoimmune response against GM-CSF, a protein in the lung. The autoantibodies prevent GM-CSF binding to the macrophages. Macrophages are then unable to process the lipids. You get a gradual buildup of surfactant in the lung over time, leading to hypoxia, shortness of breath, decreased exercise tolerance, and other complications. The current standard of care for PAP is a whole lung lavage. This is an invasive general anesthetic procedure, one lung at a time, where you manually rinse the surfactant from the lung. Obviously not a procedure that the patients or the physicians enjoy, to say the least. What we're doing is we're replacing the GM-CSF in the lung, so we have an inhaled form of recombinant GM-CSF. In a nebulizer, you replace the GM-CSF in the lung, the goal being to overwhelm the autoantibodies. You have free GM-CSF available to bind to macrophages, and then reinitiate the recycling of surfactant.
Application in nursing. The nursing staff proceeds to perform chest X-ray, bronchoalveolar lavage, thoracoscopic or open lung biopsy is performed when bronchoscopy is contraindicated. Tests that are usually done before starting treatment include high-resolution CT, TCAR, lung function test, arterial blood gases, lab test.
This is a contrast CT images of 50-year-old male who presented. This is the classic imaging finding you've seen here.
The classic imaging finding is interlobular septal thickening and ground glass lead to crazy paving appearance.
What is the diagnosis?
Most likely diagnosis is pulmonary alveolar proteinosis. It is a lung disease characterized by an abnormal intraalveolar accumulation of surfactant-derived lipoproteinaceous material. On imaging, pulmonary alveolar proteinosis is classically associated with the lung crazy paving pattern on CT, although it is a rare cause of this non-specific finding.
What is strongly associated with the disease?
Smoking. Smoking is strongly associated with the condition, and in smokers, there is a recognized male predilection, which is absent in non-smoking patients.
This patient has a brain abscess. What do you think the culture is gonna grow?
Superimposed infection, especially with nocardia steroids, although there are many others like Aspergillus, Candida, Cryptococcus neoformans.
Student doctor, what do you know about pulmonary alveolar proteinosis?
It can be primary, 90%, or secondary, 10%. Secondary causes include cancer or inhalation silicoproteinosis. They are at increased risk of nocardia and can have nocardia brain abscess. Smoking is strongly associated with the disease. When the disease presents before the age of 1 year, there is an association with thymic allymphoplasia. Later stage it can progress to pulmonary fibrosis in 30%.
Pros and cons. Pros. The treatment of choice continues to be a total land-lavy. Treatment depends on the form of PAP, and it has been described that in the congenital form it is lung transplantation. In the secondary form it is based on the treatment of the underlying disease, and in the idiopathic form it is BAL. Cons. Its origin is unknown. It is more frequent in adults between 20 and 50 years old with dyspnea and non-productive cough. The predominant gender is male. I should apply in Ecuador. PAP is a different clinical entity with an estimated prevalence of 0.1 cases per 100,000 individuals. Mortality of 30% and 2 years has been reported in adults. Before the routine use of bronchoalveolar laving, 5 years mortality has now been reduced to approximately 5%. In children, that figure is much higher due to reduced efficacy of bronchoalveolar laving. Conclusion. The crazy paving pattern, characterized by scarred or diffuse ground glass or attenuation opacity with overlapping interlabial septal thickening and intralabial lines, is a common radiological manifestation. It is often considered to have a limerick differential diagnostic: pulmonary alveolar proteinosis, lipoic pneumonia, bronchoalveolar cell malignancies.